Hello, everyone, and welcome to WH&Y's webinar for November. I'm Kate Steinbeck, and I will be chairing this. And just a few housekeeping rules before we actually start. So, we are the Wellbeing, Health and Youth NHMRC Centre of Research Excellence in Adolescent Health. I need to acknowledge our funders and all the universities that contribute to our research program. And if you're interested in learning more about us, here is our website. Before we start, I'd like to acknowledge the traditional owners of the country throughout Australia and recognise their continuing connection to land, waters and culture. And we pay our respects to their elders past, present and emerging. Just a few things to remind you. Your microphone will be muted and your video switched off while our speakers are presenting. At any time, you can use the chat box, which is on the top right hand of your screen, just to react to what's going on or say hello or send a comment. If you have a question, I would like you to put that question into the bottom left where we have a question box, and we'll answer those questions at the end of the presentation. I'll keep an eye on them in case we have to answer them earlier, but please be thinking of questions from the beginning because our presenters love those. And I'm going to present our two presenters, both of them who are actually part of the YCRE. So it's my pleasure to first introduce Dr. Sally Gibson, who has more than 25 years' experience in service provision, policy development, education and research. We first met Sally when she was at New South Wales Health for 7 years up to this year, where she led the implementation of the policy response to youth health and wellbeing across the state, and it was fabulous to have us with her. Sally has moved to South Australia and is now the Senior Advisor for Mental Health and Wellbeing in the South Australian Department of Education. And so we're delighted to welcome Sally. It's lovely to see your face again, Sally.
Thank you, Kate.
And then our second presenter is Dr. Dan Waller, who is a postdoctoral research fellow both at the Faculty of Health at the University of Technology in Sydney and also with us here at the Children's Hospital at Westmead, where this broadcast comes from. Dan's research interests include implementation science, evaluation research and intervention mapping for public health programs. He's currently finishing off a scoping review of Australian youth health policy, which I think you'll all find very fascinating when it's published. And so I'm handing over to Sally and to Dan. Thank you very much for joining us as our guest speakers today.
That's good. Yeah, so welcome everybody. I'm going to be the first speaker, just setting some scene for us. And then if Dan goes to the next slide, Dan is driving our slides. So I'd really like to say it's a great opportunity to talk about youth health policy and to do this with Dan, because we come from different perspectives and it's great to do this as a tag team. So I'll be doing a little bit of scene setting, not much at the beginning, putting the question around, does youth health policy matter? And then Dan will actually then present his research and scoping review, his methods and findings. And then I'll come back really to talk a little bit about, from a perspective of a practitioner. So what I'll be presenting is really a personal opinion and reflection rather than a research-based approach. It's something I call the Gibson-Weiser approach to policy development. So that's the outline that we'll be doing today. And so clearly, all of you who are watching this, I'm sure knows and cares around young people's health, and that it matters, that we need to be doing better for young people. I mean, the Lancet Commission on Adolescent Health has provided a great sort of evidence base for us around why it matters. We know it matters for young people themselves. to keep them healthy as possible as they go into adulthood. And that's all young people trying to be as healthy as possible, regardless of whether they have disabilities or chronic health conditions or mental health concerns as well. It's about prevention for the future, but it's also about the community. So Youth Health matters because we want a community that's able to contribute and are productive as well, and also about the healthy future generations. And I think that epigenetics is showing us that it's really important to be able to keep as healthy as possible in order to have healthy future generations. So if young people's health matters, what about youth health policy? Does that matter? Does it make any difference to have a policy around young people's health? And if it does, why is it so difficult to actually sometimes get those policies developed or get them implemented? So this slide shows that putting an emphasis, showing that young people's unique needs, having responses to that is part of the argument for having youth health policy. Young people are often underrepresented in what's spent on healthcare and what the research is. But as Dan will show, there's a lot of difference across Australia in terms of the policy approaches that are taken as well. And so finally, before Dan speaks, I've got a but there, and this is what I'll come back to a bit at the end of after Dan's presentation, because I think we all know that policy can sound like quite a clear process. And I think particularly in health, when people are used to sometimes doing clinical policies, where there can be quite a scientific approach to doing randomized controlled trials or things like that, and where the evidence base can be a bit clearer. But my experience is that doing policy is around competing discourses often, and there's a real tension between the image of what the policy design process is and what those of us who might be in the thick of trying to do that activity actually experience. So I'll come back to some of these themes later, but now I'll pass over to Dan and he'll do a presentation on his research. Thank you.
Thanks, Sally. And I'd like to reiterate that it is really nice to be able to co-present with Sally, because I think, yeah, we have very quite different backgrounds, but quite complementary as well. So whilst Sally has a wealth of experience in the development and implementation of policy, I have a research background, so I'm kind of looking at the theoretical perspectives that sit behind that, and really kind of sitting on the outside, just scratching my head, trying to figure out how it all kind of fits together. So part of the work that I've been doing has been a scoping review of Australian policy, and the aim of that work was to try to determine the extent, range and nature of recent policy specific to the health and wellbeing of young people within Australia. So the scope of that work was looking at prospective policies, plans, strategies, blueprints or frameworks, and we're interested in publications that were coming from Australian federal, state government departments that had been published from about 2008 to 2019. So what we were trying to do was find policies that were relevant to young people, and we're looking at their general health and well-being. So rather than specific policies, say on diabetes or drug use or things like that, we're looking at general health and well-being, and also the general population. So not looking at specific groups of young people like Aboriginal or Torres Strait Islanders or youth in out-of-home care. So we're looking at the general health and well-being of general young people. So we had a couple of research questions for the scoping review, and the first question was, what is the coverage of Australian federal, state and territory policies specific to the general health and wellbeing of Australian young people, published between 2008 and 2019? And what were the kind of key themes that were coming out of those documents? So we considered a scoping review to be the most appropriate design for this kind of research. It's an alternative to a systematic review, which is really good if you're doing exploratory research in broad topic areas. Also, particularly if you're working in an area where there's a lot of grey literature or non-research articles. So that's obviously very important for policy research, where we're not having, they're not research designs. So it allows for the qualitative analysis of these documents as well, which means that you can kind of identify key themes that are in those publications and policies. Scoping reviews are increasing in popularity based on this kind of some of these benefits. And you can see a lot of publications coming out over recent years that have featured scoping review methodologies. So within our scoping review, we also conducted thematic analysis of the documents. So we were identifying key themes that were within these policies, and that was done through an inductive coding approach where we had no preordained theoretical structure. We were looking at the information within those documents, coding some of that information, and then building semantic themes that came from that. So this is a really nice approach to policy analysis because it kind of reduces bias, and you get to see what are the key kind of factors and themes that are coming out of the policy documents. What are the things that are generally across the different policies. So to identify the policies that we were interested in, we looked at 126 government departments and agencies that we identified through government directories, where the links are there. And we also looked at some peak policy websites and peak bodies as well. So we looked at the Australian Policy Observatory, the Australian Association for Adolescent Health, the Student Wellbeing Hub, and youthpolicy.org. So once we'd identified the websites that we wanted to search, then there was a two-step process there. So the first step was to navigate to a publications page if there was one, and we tried to identify any relevant documents there. And then the second step was to use the website search tool. So we had a lot of keyword search terms that we entered into the search tool, and those were so youth, young, teen, child, adolescent, and health, wellbeing, or risk, or plan, policy, strategy, blueprint, or framework. So we're trying to identify policies and publications that were relevant. So for the inclusion criteria for our scoping review, the publication needed to be a prospective plan, policy, strategy, blueprint, or framework. It needed to be published from an Australian federal or state government department, and it had to be relevant to the general health or wellbeing of young people. So again, we're interested in the general population of young people, and we're aiming for policies that looked at the age group of about 8 to 25 years. Importantly, we did have a few policies that came out that didn't have a specific age range that was identified, but we included those because they discussed adolescence and young adulthood. We also included any policy publications that included pediatric groups as well as adolescents and young adults as well. So the documents were published from 2008 to 2019, and we also included expired or rescinded publications because they are still relevant to the policy environment over the previous years. So using this approach, we identified 12 policy publications from Australian governments and state and territory governments. And there's some of the information about those within this slide. So what you can see is there's a fairly good coverage across states and territories and federal governments in regards to youth health policy. There were 3 national health policies, 3 from New South Wales, 1 from Victoria, 1 from Queensland, 2 from Western Australia, 1 from Tasmania, and 1 from Northern Territory. Importantly, South Australia has a youth policies that are in place, but they weren't specific to youth health. And the Australian Capital Territory is also in the process of developing a youth health policy as well. So there is still movement within this space. So if we look at the timelines for these policies, what we can see is that there's actually been quite a lot of interest in youth health policy in Australia in recent years, particularly from 2018. And so there is actually quite a few relevant policies that are actually in place at the moment. And it shows that there seems to be a growing area of interest for policy. And if we look at the age groups of these policy documents, you can see that there's actually a fair bit of variation in the age groups that are being targeted as well. And this kind of shows that there is this kind of difficulty in kind of having hard boundaries for what we define as a young person or as a young adult or an adolescent. So some of these policies were relevant to 10 to 25-year-olds or 12 to 24-year-olds. And some of the policies looked at the range from pediatric to young adulthood as well. I guess this is an issue across research and other international policies as well, where it is difficult to kind of have these hard boundaries. But there is potentially implications of these policies if there are tied to services that are available for young people. So it is something to be considerate of. So we conducted a thematic analysis of the publications that we had, and what we came up with was from our analysis was these 3 meta themes, which kind of explained the majority of the information within the publications. So the 3 meta themes were policy aspirations, which is, what are the goals of the policy? What are we trying to achieve? Policy foundations, which is, well, how is the policy being developed? What information do we have to actually create this policy? And what are those processes? And then we had policy implementation. So how are we actually going to achieve the goals that we set out to? So looking at the policy foundation theme, there was a number of sub-themes within that. So we did have this issue of defining youth and trying to find hard boundaries, which is going to probably be an ongoing issue that's never really solved. If we're looking at the definitions of health, what we see is that there is actually quite a lot of interest and increasing interest in health in regards to well-being and resilience. So we're starting to kind of get towards this understanding of youth health as being very important from a physical health perspective, but also from a mental well-being and social well-being, and looking at social outcomes as well. So the definitions of health within youth health policy are actually broadening to have this kind of broader understanding of well-being. All of the policy documents identified key health issues for young people. So some of those were obviously mental health and suicide, risk-taking behaviours, drug use, sexual behaviours. And what you can see in the more recent documents is that there is a bit of a consideration of things like health and safe use of internet, exposure to pornographic content or violent content, cyberbullying. So there's a few issues that are kind of coming through in policy that weren't necessarily around 10 or 20 years ago. Interestingly, the Victorian health policy was the only policy to consider the determinants of climate change on the health of young people. So it'll be interesting to see whether that is a consideration in health policy going forward for this group. The majority of the policies did consider the socio-ecological determinants of health. So there's a lot more of a focus on, well, what are the kind of key disadvantages that are really impacting young people's health, and things like access, socioeconomic status, cultural issues, these kind of things. Where are the kind of boundaries and the intersectionality that can have implications for a young person's health? And they also consider life course approaches. So there is this increasing understanding that if we do intervene early, this can have a very significant impact on the health of young people in their futures. So considering the life course approaches to health is really important and does seem to be considered in policy. The policies also were quite well supported by research and evidence, particularly the newer ones. A lot of the policies were developed on the basis of quite large-scale surveys and studies with young people, and consultation and co-design is increasing as well. So we can see that some of these policies were developed in conjunction with a reference group of young people who were trying to identify what's important to them for youth health. So there does seem to be this growing voice for young people, which is really what Y is trying to do. All of the policies had links to other policies within the broader scope of health, and also the broader general policy. So there was quite a few links to education policy, for example, for young people, or particular services and things like that as well. So moving on to the policy aspirations theme, what occurred was there seemed to be these quite clear goals that were across different policies. And these came out quite clearly, and they were the 3 key policy aspirations were around access and equity, integration and navigation of health services, and the prevention, early intervention and management of conditions. So the access and equity theme really did consider the socio-ecological factors that are important for a person's health, and really underlined the importance of universal service access, and started to consider things like geography and inclusiveness of services, youth-friendly services, cultural competence, and things like flexible hours for people who might not be able to get to services in standard operating hours. The integration and navigation theme really emphasised the importance of integrating services and information sharing across services. So that might be specific health services having a better information sharing processes, or it might be considering transition from paediatric to adult services and making sure that the young person has a very smooth journey across those. It was underlined that cross-sector collaboration is important, and the number of kind of methods for improving that, and working even with, say, education or the Justice Department and things like that to be able to have better health for young people was underlined within that theme. And there was some discussion of navigator roles for that kind of transition of care, particularly for people with chronic conditions. It was good to see that a number of the newer policies really focused on empowerment of young people, trying to increase health literacy and make sure that people are understanding their health conditions are able to navigate the health system effectively. And then in regards to prevention, early intervention and management, there was a very strong focus on public health and health promotion approaches, emphasis on early intervention to reduce risk and to also reduce the long-term health issues and burdens of the disease, particularly again for people with chronic conditions. And then the final theme that looked at policy implementation, I guess this was probably the theme that was the least well described within the policy documents and had the most variance across the policy documents as well. So there was some discussion of funding and governance structures that are relevant to the policies within some documents, whereas some of the documents really didn't have very much information about that at all. There was also discussion of the infrastructure and technology that is needed for trying to achieve some of the goals that are set out in policy. And there was also a discussion of the workforce and the importance of retaining and training highly skilled health staff. So looking at kind of ways for professional development and engagement of staff and keeping those people on board. The discussion of planning, monitoring and evaluation of policy, again, was very varied. Some of these documents had quite strong planning and monitoring frameworks in place to kind of see how this policy is going to be implemented and evaluated, whereas some of them said, well, these are the key goals that we have, and then didn't provide too much information about how we're going to get there or what the kind of funding or governance structures that are there to be able to support those. So from our scoping review, we came down to with about 3 key learnings from our review of the policies that we looked at. And the first key learning was that approaches towards developing youth health policy in Australia are actually getting stronger. So there is increased interest in youth health policy. There's been a lot of policy development in recent years. And these policies are moving from a deficits model of health towards a strength-based approach. So really considering well-being, resilience, those kind of important factors, as well as physical health. There is a good recognition of socio-ecological factors and intersectionality that impacts health and disadvantage. However, there is a research article that has critiqued Australian youth health policy in this area and suggested that whilst it is identified as an issue, there has not been much policy action that has kind of focused on this to try and reduce that kind of entrenched inequity. Finally, there is increased research and youth participation within policy formulation, not so much implementation and the other kind of stages of policy, but we are seeing a bit of a growing voice for young people. And I guess it's really great to see the Y Commission with the young people and the Consumer Health Forum with Youth Advisory Group, which is really focused on this kind of giving young people a voice, letting them tell us what's important for their health, and then having that translated into important policy and research. So the second key learning is that there are actually 3 fairly clear and unanimous policy aspirations for youth health in Australia across these policy documents, and these are access and equity, integration and navigation of services, and prevention, early intervention and management. So these kind of serve as a pretty strong kind of marker for us to say, well, these are the things that we need to be focusing on. If we're looking towards policy development in the future or developing a blueprint for future policy and implementation work in youth health, these are probably the things that we want to focus on. And they can also lead a research agenda. So if you're developing research themes within youth health, these are probably some pretty important things for you to look at. Interestingly, after I had conducted the analysis for this scoping review, I started to look around internationally to see what kind of goals were being promoted through other organisations. And you can kind of see that there is this international group that are starting to look at the similar issues. So this is from the UK Royal College of Paediatrics and Child Health. And if you see their key priorities, they have very similar priorities that are outlined in Australian health policy as well. So you can see reducing child health inequalities, access and equity, prioritising public health prevention and early intervention, early intervention and management, and building cross-sector services as well. So that's integration of services. Interestingly, navigation isn't necessarily picked up here, but that's probably because it's more relevant to paediatric care, these key priorities, whereas we're interested in adolescents. So navigation becomes a real issue when we're transitioning from these kind of paediatric to adult services. Nevertheless, it suggests that, again, these kind of key themes look like something that we should be interested for research and policy making. And then our third key learning is that the proposed methods for the implementation of Australian youth health policy recommendations are as yet unclear. So the discussion of policy implementation varies quite widely across documents. There's limited discussion of budget and governance, limited planning, monitoring and evaluation frameworks that are developed for these policies, limited implementation plans, and also limited success measures as well. There is variation, and some of these come with an implementation plan. Some have come with an implementation plan that wasn't then put into place. But there is this kind of wide variance across policies. And this isn't necessarily surprising because sometimes these policies are created without any kind of budget to support it. So it's quite difficult to say, well, this is how we're going to achieve our goals if there's no kind of framework to implement those changes. This was actually identified as a issue within the Henry Review, which was a review of New South Wales health services for children, young people and families. And one of Henry's key recommendations was that all future health frameworks in New South Wales should be complemented by an implementation plan, outcome measures and monitoring of both policy implementation and policy outcomes. So this kind of speaks nicely to our findings, and our findings complement this by suggesting that this is actually a national issue. This is something across national policy that needs to be addressed. So with our findings, it's important to consider with the limitations of the research. We had a narrowed scope where we just looked at health policy relevant to young people in general health, not specific conditions or specific populations. So we may have excluded some potentially interesting or relevant documents. However, it does provide us with a much stronger focus to kind of see what's generally out there for young people. We conducted thematic analysis, which really indicates what is within a document or within a policy rather than what's missing. And there's limited theoretical underpinnings for this approach, which means that we can't really do any kind of hypothesis testing. We had a single researcher who did most of the coding and qualitative analysis. However, we had a research group at each stage to check the coding and contribute to the research themes. And we did no international comparisons within this particular study. However, that's something that we are interested in looking at within the future. Finally, it's a fairly time-consuming process as well. So in conclusion, based on our findings, policies in Australia is heading in the right direction for young people and their health. However, there are numerous opportunities that remain, particularly around providing a greater voice for young people and also the implementation of policy. So the next steps for me is we have this work that is under review at the moment for a publication. We'd like to look at some of the international policies and compare there, and also conduct some qualitative research to try and understand these issues a bit more. As Sally said before, research can be very straight line and suggest that everything works very easily, whereas often where real policy development and implementation is working in chaos. So this is a very simplified kind of overview of how policy is working. So it'd be great to do some qualitative research to understand that a lot better. And then working towards this to try and get at implementation of policy and get a blueprint for advocacy and development of policy and research moving forward. So just quickly, some of the qualitative research that I'm hoping to do that I have ethics approval for at the moment is to talk to policy developers and policy makers about some of the issues around developing policy and policy implementers about some of the issues about implementing these policies. So where are the kind of bits that are missing that we could improve? Trying to look at evidence makers, so researchers, and how can we better move evidence findings quickly into policy so we can have a stronger evidence-based approach which is more current, and then also talking to consumers, so young people and family, and what's important for them for policy. So I'm going to be talking to policymakers quickly at first, and then we're going to be looking at some theoretical approaches. So looking at some of the stages of policy, a theoretical approach that looks at advocacy coalition frameworks, which is kind of trying to understand the actors and the processes involved and how it's a very dynamic process. Looking at some of the policy tools that we're trying to use to change people's behaviour and health behaviours. And then also looking at theory, which is punctuated equilibrium theory, which suggests that policy moves in a relatively gradual and steady pace until there's a big change or a societal change. And I think that COVID-19 is one of those kind of issues where we are seeing quite a rapid development of policy and change societally. So it'll be interesting to see what the impacts on policy development are there. So probably most particularly relevant to things like access and the use of technology to increase services, particularly for geographically diverse, regional people and those kind of things from all over the country. So yeah, plenty of research to go ahead, and I think I'll pass over to Sally, who will give you a much more in-depth detail of some of the more spiky issues of policy development and implementation.
Thanks, Dan. And no doubt in the future, given that you're going to be doing research, interviewing policymakers, you know, we might talk more later. And also, I'm sure there's other people who are watching this who may be good people to interview too around some of those policy development processes. I thought I'd start with this is sort of a typical policy development cycle that's often used in government. So you define a problem, then you come up with options to address that problem, then you submit it up for approval to proceed, and then you implement, and hopefully we can talk about implementation plans a bit later. And then you have an evaluation monitoring process as well. So certainly that process is a process that I have tried to follow many times. And I should say I'm sort of talking about my experience primarily in working, developing the New South Wales Youth Health Framework. But prior to doing that, I also had developed HIV strategies for South Australia as well. So I'll be drawing on some of that experience as well. But the next slide actually shows you what the experience often feels like when you're doing policy development. So I'll get Dan to just press on that. Yeah, so practical policy making really can feel like herding cats. And I'd like to think maybe, is that me out in the horse, or is it someone above me, or am I one of the cats, in fact? But generally policy making is trying to get things to at least go in some sort of a coherent direction so that you can maximise impact on the areas that you're trying to make that change. But it can be really tricky. There's often different silos. So mental health doesn't talk to sexual health, doesn't talk to drug and alcohol use. You've got different strategies that deal with that. And then you've got the clinical arms and the children's hospitals, and you're trying to get that all to work together. So I have to say that it can be quite challenging at times, but always interesting. So I thought I'd just share some of my own views really, and I've called it the Gibson's Wiser Policy Approach 2020. Don't go looking for it in Google Scholar because it's not published anywhere. It's really an opportunity to name something after myself. So my wiser approach, some of this is the typical policy development implementation process. I think the why are you doing a policy is really important. So when I came into New South Wales Health, there were people before me, and Kate Steinbeck and others, David Bennett, Melissa Kang, others, had been involved in developing a youth health policy for New South Wales many years ago. And that did provide a frame, a lens, an emphasis on young people, which is really important because the health system often neglects young people. But as we came forward and was saying, that ran out 2012, I think, or 13. And then that was an impetus about, well, are we going to do another one? And if we are, why are we doing it? What's it going to deliver? So my view, and certainly of the stakeholders as well that we consulted with, is that in the absence of having a youth health framework, those that are working on youth health in New South Wales Health really don't have any sort of legitimising document for the work they're doing. And so that was seemed to be important, that we have at least a statement of commitment to young people's health, and that we update some of the latest thinking about how you might do that. So, but you still need to have a sort of convincing why, because you are within quite a crowded space of policies and frameworks that you have to justify. So when you're in government, sometimes it's the hardest thing is also finding out, are you doing a policy? Are you doing a guideline? Are you doing a strategy? Are you doing a framework? And I can't tell you how sort of perplexing and frustrating at times it is to know what language you're using for what you're doing. But there can be real gaps that need to be met. And obviously looking at some of the evidence for why you're doing things is really important, but also being opportunistic about it. So in New South Wales, we had Brad Hazzard as the health minister, and so we sort of really timed also the release and development of the New South Wales Youth Health Framework to the National Youth Health Conference to enable also the minister to show his support for young people's health. You've got to think about what it is you can put in a framework or a policy that can be actually implemented, because you need to be aspirational, as Dan said, but sometimes if you're too aspirational, then it's not going to get, one, it won't actually get out of the department, it won't get approved, but also it might leave you with a lot of things that never get done, and then questions can be asked about that. So, I mean, I had the experience working in HIV when there was a need, or there was some people thought strongly that we should be putting in that there should be provision of clean needles within the correctional services system. But that was not something that we were going to get past the health minister. And so you end up sort of changing language to recognise the risk, but you use different words like strategies to prevent harm within correctional services. And if the cultural changes around you, maybe there might be some action, but you don't want to jeopardise getting a policy through sometimes for the sake of some words, but some things are so important that you really do have to advocate for that as well. I'll talk about implementation a little bit more in my next slide. The stakeholders are really important, and clearly young people are a stakeholder. And for the development of the New South Wales policy, we did hold 2 consultations with young people. We actually also used the research that we'd funded through university, through Melissa Kang's group, and so the Access Research Study 3. So that provided a lot of information for us about young people's access to healthcare that could then go into the framework, New South Wales Youth Health Framework as well. But then we also held 1 rural youth health policy consultation and 1 out in Western Sydney with about 100 young people as well. But clearly then also the other stakeholders are the health professionals, the health managers. We made the decision that the framework for New South Wales was going to be really just for New South Wales Health. So we weren't trying to take on what family and community services were doing around the determinants or what GPs are doing, which was beyond the scope of what we could actually influence. But we did recognise that there are partnerships that are important. I put the word encourage in my WISER, which is something I'd thought about quite a lot, and I'll talk about it a bit more on the next slide. But clearly E could also stand for evidence, which is really important, and how you use that. And you often use that within a narrative where it's about trying to influence and advocate, but also evaluation. And I was interested to hear from Dan's presentation. My experience of evaluation of policies and frameworks has been that it's been very, very difficult. More often than not, when a policy comes to an end, and this is true for the HIV policies I was involved with, as well as the youth health policy, it's more a review process that takes place, mainly because an evaluation framework is often not in place for a policy, and that's also linked to some of the difficulties with resourcing around implementation. So there, I do, of course, think it's really important to have some agreed measures of success, but I think it is an area that we need to get quite a bit better in. I'll just go to my next slide, which looks at the I and the E in a bit more detail. My experience of working, particularly in youth health, has been, as well as very rewarding. That implementation is really challenging, mainly because there is often very little funding. And you're also often competing against other priorities. So the value, can you show value for what the interventions are? Is it saving the system money somewhere? What's the cost benefit of what you're doing? So we may have some small elements where we can talk about preventing ill health in the future and the costs that will get saved, but it can be very difficult to show that if a health service reorientates about how they deliver to young people, that will actually save the health system any funds and money in the future. I've also learnt, and we did try to set this in place with Youth Health Framework, that you do have to make expectations clear and have some level of accountability. So what we did for the New South Wales Youth Health Framework was that we did have an annual planning and reporting process with each district and the Sydney Children's Hospital Network. And that really was so that every year they had to think about what they were doing and report back to us on what they'd done. Some might say that's quite a low level amount, but it did provide an opportunity for those working on young people's health to brief their chief executives at least once or twice a year. And also, if they were wanting to do things around young people's health, they could also say, well, it's in our annual plan, we've committed to do it, and we need to do it. I think leverage is really, really important when you're working on young people's health policy. And my experience is that there can be new priorities or sort of new things that come in that are really really helpful. So in New South Wales has now got a rural youth policy, so that's an opportunity to promote young people's health in rural areas. Mental health is getting a lot of attention. I'm working in the area of mental health and wellbeing at the moment, and clearly we are seeing some of the distress and anxiety that's happening from COVID, and also I think some other influences on young people's mental health and wellbeing. Just on the COVID issue, I think it is an opportunity, and I know that there's been some researchers with WH&Y who are looking at telehealth and how to deliver healthcare to young people through using telehealth. If you'd put a proposal up around using telehealth, a year or so ago, it probably would have been quite difficult to get funding for it. Often young people don't have the chronic health conditions that people are really focusing on for telehealth. But I think COVID obviously is presenting a lot of challenges, but also a lot of opportunities about showing how to do healthcare differently, including with young people. The other thing that we did do to support the youth health policy in New South Wales was developing guidelines and trainings, things like doing the HEADS psychosocial assessment, getting through that in New South Wales Health. It was an expectation that that would happen. There can be a big gap between setting an expectation and actually making it happen. But if you actually don't have it there and written that young people there should be a conversation around their holistic healthcare, then you will never have a chance to make that influence happening. And around that, then you can also put things like training and development, and even building it into the electric medical record as well, which is what we managed to do. So there can be some good outcomes from just trying to influence the system at quite a small level. I just want to finish really also around the E and around implementation. So the Henry Review, quite rightly, and I was interviewed as part of the Henry Review, look, there was no visible implementation high-level plan for the Youth Health Framework, and we certainly didn't have the resources to do that. We didn't have the resources to do regular reports on it. But what I really thought was important was about encouraging and supporting those who are already engaged in youth health. And that's a lot of you, and it's where WISE come from as well, the researchers, the health staff, the youth advocates, the partner agencies. And you can do that in multiple ways. And the Youth Health Framework does have this in, and it is a tradition that was started under the previous youth health policy. networking, make sure that people are connecting with each other, particularly those in rural areas who are often working quite alone really around on trying to put a focus on young people's health, showcasing the good work that does happen. So we did hold youth health showcases to bring people together, to give a focus on that, and really making some of that work visible. And those of you who are researchers obviously do that through publishing your findings of what you're doing and showing how you can make a difference with youth health. And I really do believe that encouragement and really supporting the champions and your allies is really important if we're going to grow a stronger base around young people's health, and really make sure that people understand that it's no good just focusing on the early years in child health. We really need to keep that emphasis going into adolescent health as well. So I'll just go to the next slide. And I just sort of like to thank you all for listening to Dan and I. This is a photograph that was taken at the Western Sydney Youth Health Policy Consultation, where we got to see the passion of young people out in Western Sydney for making a difference to young people's lives. And just to emphasise that giving that focus and attention on young people's health, that youth health policies can make a difference to make that happen, but clearly it also needs a lot of effort to keep it going. Thank you.
Presentation. We've certainly got time for a few questions, and you have a few questions that are actually already been sent through. So the first question that I'm going to read out is, and it's probably to both of you, COVID has really demonstrated how research and policy needs to be more responsive to changing contexts. What can help us do this in the area of youth health? Do we need different partnerships, methods, or even attitudes about young people as more than just consumers of health? Quite a lot there. Who would like to start, Dan or Sally?
Well, I'll start. I did mention COVID. I'm not sure quite about the last bit of the question about more than consumers of health.
Yes, I think it's probably a question, and it does come from Pip Collin in Western Sydney University. I suspect that Pip is asking about, is there something in the community that makes it difficult, perhaps in attitudes, for policy to either be enacted or developed?
Around the COVID?
I think more generally than just COVID. I think COVID has been, as both you and Dan have mentioned, one of those sort of key events that perhaps we only have in a lifetime.
Yeah.
It's certainly shown us that perhaps young people were not viewed very kindly in the COVID environment.
Yeah. I mean, I think that's true. And I do think that if you talk about the big H health system, there is a lot of emphasis around showing the cost benefits of what you're doing. And that can be very hard to sometimes demonstrate. And so when you're talking about often quite a healthy population, it can be really hard to sort of get that attention on the young people's health needs. And then when you do get some attention, it's usually on the sort of factors that are the very negative ones. And we're not looking at early enough about what could be done around the holistic healthcare to prevent things like the self-harm and things as well. And I think COVID's probably, if you look at where the worst impacts of COVID was being identified in terms of illness, it wasn't again in young people. So I think that's probably why there sort of wasn't an emphasis. And then we do, in my experiences, there can be very tricky issues around privacy and confidentiality, and how to deliver services, and how do you get parental consent and how do you do that? And I know that there's other researchers that are looking at those issues, but I think it's really, as I said, a great opportunity to diversify how young people can get access to healthcare. I don't know if Dan wants to say anything else.
Yeah, I think one of the important points that kind of Pip made was around attitudes and how young people are kind of perceived. And I think one of the things that is important is to make sure that we're not just doing tokenism around these kind of things. So whilst a lot of the policies are developed with some consultation of young people, it is this kind of attitude to make sure that, you know, it's not just a tick box exercise, but we actually are considering the needs and of young people. So I think having that kind of broader range of people who are involved with policy development and research and things like that. So things like the Y Commission, having those kind of frameworks who can really promote the voice of young people is really important as well.
Thank you, Dan and Sally. I'm going to move on to the next question. And the next one is, are there lessons here for child protection policy, especially given that child protection should be using a public health model?
I've also done a bit of work in that area, and I do agree, but I do think that the child protection and wellbeing response is moving much more towards that approach now. I mean, we still hear a lot about those that are within the statutory system, but the language around the policies around it is more around wellbeing as well, and keeping all children safe, and what are the circumstances, and how do you do that, and then how do you intervene as early as possible to prevent the trajectory going into more abuse or needing to go to care. So absolutely, whoever's asked that question, I absolutely agree that the public health response to child protection is really important. I do think there's a real lack of well, not a complete lack, but there should be more emphasis on the needs of adolescents. So when I was in health, I did do a sort of deep dive into files of children in care, in residential care, and the adolescents particularly were really finding big challenges getting the care they need, and a lot of them had been in care for about 10 years. And so often the stretched system only really still goes down to the bottom, to the young years. And so by the time they get to adolescence, we all know this, they sort of age out of care and they end up often in homeless or with other situations as well. So I agree that there are real lessons around taking a universal public health approach to child protection as well.
Thanks, Sally. I'm going to move on to the next question, which is about, thank you for a fabulous and informative presentation. While there's an increased focus on health policy for young people, which is strength-based, how do health departments plan funding the implementation and evaluation of these policies beyond non-monetary support or collaboration with researchers?
If anyone's got, I mean, do you want to say anything, Dan?
Question in a nutshell, isn't it? Really, I think really we're at the kind of partly at the starting point of this kind of question, and I mean, one of the key goals of some of the work of the CRE was to look at this kind of issue and see, like, well, how can we better help governments to implement policy around this area? So what I'm hoping for is to do this, conduct this qualitative research to try and understand some of those issues in a bit more detail, and then using things like the Henry Review to see where recommendations can be made to make changes. I am going to put my hand up and say that I'm a researcher. I'm on the outside. I'm giving a very simplified view of things. So, Sally, if you've got any answers.
No, I mean, I do think that external advocacy is important, and that you need to. It can be much easier if sometimes the ministers are supportive or sort of really understand. And I'm really aware of how much is going on in, say, New South Wales education at the moment. So there was a commitment made by the Berejiklian government for $88 million over 4 years to put psychologists in every secondary school. So that's not something that we have here in South Australia. So, you know, I'm sort of really aware of that. And I know that the Minister for Mental Health recently made a commitment for 100 nurses to work across schools as well. So a lot of that's not being driven necessarily out of a government department. A lot of that is based on a commitment or passion of the particular minister. So, and how does that happen? I mean, that's when I think getting, ministers out to look at programs, to hear about things, to sort of that narrative, capture the imagination, show what can be done. It can really make a difference sometimes, as well as then having the evidence base. But I have found in government that it's very difficult putting up business cases, not impossible, to get new money. But it is possible, but it can be very difficult to do that.
Thank you, Sally. I'm going to finish off with a combination of a couple of questions which have asked for the role of education and working in partnership with the Department of Education. One has asked for a comment too on the recent announcement in New South Wales of school health nurses in schools.
Yeah.
And then combining that with a question that was asking, and perhaps Dan, you've obviously used that policy. That policy is around a memorandum of understanding between health and education when it comes to dealing with chronic illness in young people. So I guess that's a couple of questions about how we can, I guess, look at different partners external to health, and whether either of you have any comments just to finish off this question session.
Just on the New South Wales, because I'm more experienced with that, there are some formal agreements between health and education. I did actually manage the Wellbeing Health Enriched Nurse program in New South Wales. That started as a small pilot. As I said, it actually really came from a drive from the Minister for Mental Health, but it did demonstrate that there are needs that can be met through that partnership. It is a little bit of a contested space. Nurses in schools is not something, it's in some states, not in other states. It's quite interesting, the differences across jurisdictions. Victoria's got the Doctors in Schools program, and that doesn't exist in most other states. So there are partnerships, and I agree that it's really important to try to get that partnership stronger. And there are some formal, I know there is a formal MOU, particularly around mental health, between New South Wales Education and Health as well. So Dan, did you want to say anything else?
Future with these kind of partnerships, having those kind of collaborations is going to be very important. And I think some of these kind of research studies that are coming out that are showing the benefits of that kind of cross-sector collaboration will be quite helpful in pushing that kind of agenda forward.
It can happen. It often does happen in a local area and it's not always visible from the centre. So I know a lot of local health districts, or through their health promotion programs or their sexual health programs, do actually have quite good relationships often with their local schools and are doing work in that area. So sometimes, and again, that's an example of where it's not the youth health policy that might drive those actions. It's actually the relationships that are really driving some of that work as well.
I think I'm going to have to finish this there, and it's probably a good note to end on the importance of developing relationships. And so I'd like to thank both our presenters for a fantastic presentation, our audience that was very interactive. And we are farewelling our webinar series for 2020, but don't worry, we'll be back in 2021, starting on the 23rd of February. I know it's been a really difficult year for many people. I think a lot of us have experienced loss in many ways through the COVID pandemic, and I just wish you all health and safety, and I hope that you all get to enjoy a holiday break. So thank you everyone for attending.
Thank you.